Well, welcome back, everyone. Today we have Dr. Abro here with us today to talk about cardiac rehab. Now, first, can you tell us a little more about what cardio rehab is and why it's so important for those who have experienced critical heart problems?
Well, good morning. Thank you for having me. So cardiac rehab is basically for all our cardiac patients that have gone through some procedures, be it bypass, stents, or valve surgeries, or any kind of structural intervention. So it's basically a rehab is more of a structured environment for our patients, so they know what they cannot do, and they give them a lot of education about risk factor modification, and so make sure they do well for the rest of their lives.
All right. So, now who might require a cardiac rehab? Who might need that?
So I recommend cardiac rehab for any of the patients who have had any kind of intervention or known heart disease, but it's not exclusive for cardiac patients. We have also patients who have lung issues too. So cardiopulmonary rehab, and also people who have peripheral vascular disease, who have like a lot of pain in their legs, they have circulation issues. So is comprehensive intervention where is for cardiovascular health. So anybody needing any intervention for their risk factor modification to improve their quality of life, we recommend cardiac rehab, but especially those patients who have had known history are the ones that we are more targeting.
Right. So what can someone expect when they do go through cardiac rehabilitation?
So the main thing is more activity. So a lot of times when these patients come in, they come in with heart attacks and a lot of these valve issues or cardiac or pulmonary issues, they live very sedentary lifestyle. So cardiac intervention or cardiac rehab is basically to encourage them to be more active, so they stay healthy and stay active, so they don't get into the same situation again and again.
Yeah. So what can someone do if they maybe would like to learn more about cardio rehabilitation at Lima Memorial?
So we have our website you guys can get access to. There's a number that should be down the display. You can call. So, anybody with any kind of cardiac issues, we're more than happy to get them involved in our program and get them back into their daily activities.
All right. Well, Dr. Abro, I want to thank you so much for joining us today. Appreciate it.
Thank you so much for having me.
All right. Well, don't go away because we have more when we return.